Hello, bonjour, année moitié. My name is Dr. Erin Pelche, and I'm a family physician with a special interest in cancer. I work for our North-East Regional Cancer Program to be the voice for First Nation, Métis, Inuit, and urban Indigenous peoples. I've probably been to your community or have spoken to some of your health center staff since I started this work in September of 2019. I've heard from many people about what's important to them. And today, in this short video, I want to talk to you about what is important to know about screening for cervical cancer. I've made these videos on different topics that you've asked to hear about, and I hope you find them helpful. Be sure to look for the rest of my videos about what is cancer and screening for breast, colorectal, and lung cancer. I've also included how to get more information at the end of every video. Thank you. Merci. Miigwech. Let's start with what is cancer of the cervix. Cervical cancer happens when cells on your cervix grow more quickly and differently than other cells. This can cause changes in your cervix that you can't see or feel. Cervical cancer is one of the most preventable cancers. In Ontario, First Nations women are more likely to be diagnosed with cervical cancer than other Ontario women. Screening is the best thing you can do to find cervical cancer early. In Ontario, cervical screening is done through the Ontario Cervical Screening Program. They recommend that if you have a cervix and have ever been sexually active, you should be screened with a human papillomavirus test, or HPV test, every 5 years, starting when you are 25 years old. You should keep screening until the age of 70, or when your healthcare provider says it is safe for you to stop. We said that cervical screening is done with an HPV test and that it can find changes in your cervix. But how does your healthcare provider check your cervix? Your cervix is close to your womb, where babies are carried. During the test, your healthcare provider uses an instrument called a speculum and gently inserts it into your vagina, opening it so your cervix can be seen. A brush or a swab is used to gently take a few cells from inside and around the cervix. The cells are sent to a lab where they are examined under a microscope. Both you and your healthcare provider will get the results of your test. If your test is normal, which means no changes were seen, you will get a letter in 5 years reminding you to be screened again. If your test is abnormal, which means changes were seen, your healthcare provider will arrange for you to have more tests done. Most people who need to have more tests done will not have cervical cancer. Not all changes in your cervix are cancer, but going for extra tests to be sure is very important. We've learned a lot about cervical cancer in recent years and are learning more all the time. We now know that almost all cervical cancer is caused by a virus, the human papillomavirus, or HPV. HPV is easily spread by close skin-to-skin contact, usually during sex. Usually there are no symptoms and you do not know you have HPV. Most people can fight a HPV infection without treatment. Sometimes HPV infection causes the cells in the cervix to change into cancer over time. This is why screening for changes is so important. It can find changes early, which can be treated and prevent cancer altogether. Besides going for regular screening, there are other things you can do to help your risk at any age. Consider getting the HPV vaccine. It is available to young people in grades 7 to 12. Usually this is done at school, but may be done by your local health center. Men and women in their adult years may also benefit from getting the vaccine. There may be a charge for this. Ask your healthcare provider for more information about the vaccine. Also, Pay attention to any unusual changes in your body. Some of these changes could be bleeding between your menstrual periods or after sex, pain in your pelvis area for long periods of time, a change in your vaginal discharge. It could be a change in smell, it could be watery or red. Having vaginal bleeding for long periods of time, longer than 2 weeks, or if you are menopausal, which means not having a period for more than 1 year, and bleeding begins again, you should see your healthcare provider. And finally, always remember that healthy living, like we talked about in my first video, may lower your chance of getting cervical cancer, as well as many other diseases. I hope you'll take the next step and talk to your healthcare provider about cervical screening. Thanks for watching. To get more information about cancer, cervical screening, or other programs, you can contact me at Northeast Cancer Screening at hsnsudbury.ca.